Hi, I'm Holly. In this short video, we'll review the basic steps for reporting adverse clinical privileges actions to the NPDB. Accurate and timely reporting is essential for promoting quality healthcare and protecting patient safety. The reports you submit will assist other healthcare organizations to make informed decisions about practitioners they license, privilege, credential, or hire. Hospitals and other eligible healthcare entities are required by law to report certain adverse clinical privileges actions. Clinical privileges include, but are not limited to, privileges, medical staff membership, network participation, and panel membership in which a physician, dentist, or other healthcare practitioner is permitted to furnish healthcare by a healthcare entity. These healthcare entities include hospitals, clinics, surgery centers, and health plans, among others. Now, let's discuss the basic reporting requirements you need to consider when your organization takes an action on a practitioner's clinical privileges. Our guidebook, which is based on NPDB regulations, is available on the website and serves as a policy manual for the NPDB. In order for a clinical privileges action to be reported to the NPDB, the law specifies that the action must be a result of a professional review activity that adversely affects clinical privileges for more than 30 days. And the action must be based on the practitioner's professional competence or conduct that adversely affects or could adversely affect the health or welfare of a patient. Examples of reportable actions include summary suspensions, reductions or restrictions of privileges, and denials of clinical privileges that are the result of a professional review. Additionally, the surrender, non-renewal, or self-restriction of privileges while under or to avoid an investigation related to professional competence or conduct is reportable. Routine reviews, such as regularly scheduled peer review or practitioner assessments, are not considered an investigation and are not reportable. However, if a routine review uncovers areas of concern and becomes focused on the competency or conduct of a specific individual practitioner, it is considered an investigation. For example, a for-cause focused professional practice evaluation, FPPE, is an investigation. For more details on how the NPDB defines an investigation, please visit the Reporting Clinical Privileges section on investigations in Chapter E of the guidebook. While your organization must report physicians and dentists, you may also report clinical privileges actions on all other healthcare practitioners who have been granted clinical privileges at your organization. The report must be submitted to the NPDB within 30 days of the date the action was taken, and a copy of the NPDB report must be forwarded to the appropriate state licensing board. When you're ready to submit a report, sign into your NPDB user account and select the Report option to get started. Visit the How to Submit a Report page for step-by-step instructions for submitting clinical privilege action reports. Now that we've completed this brief overview, please review the NPDB regulations and Chapter E of our guidebook for additional information and assistance. We're available to help. If you have a detailed clinical privileges reporting question or are unsure about a reporting requirement, please contact our Customer Service Center. Our contact information is available at npdb.hrsa.gov/contact. We look forward to helping you answer your reporting questions.